A bacterial vaginosis infection can cause some very uncomfortable symptoms. But is bacterial vaginosis a sexually transmitted infection? And how is it treated? This video will cover everything you need to know about bacterial vaginosis. Hey everyone, my name is Dr. Graham Dersnah. Welcome to Bite Size Medicine, where we learn about common medical topics so you can take control of your health. While you're watching, make sure to like, subscribe, and comment. Let's get started. Bacterial vaginosis is extremely common. Almost 1 in 3 females in the US have bacterial vaginosis, making it the most common vaginal condition between ages 15 and 50, although it can happen at any point in life. It is not a sexually transmitted infection, but there are still signs and symptoms, risk factors, treatment options, and complications to having the infection, and we'll cover each of them now. The infection that we call bacterial vaginosis, or BV, is caused by a bacterium named Gardnerella Vaginalis. It is a bacterium that is normally present in the vagina, but for various reasons that we'll discuss, it overgrows and leads to the symptoms. It is not considered a sexually transmitted infection, so any male sexual partners will not become infected, but it is possible to transmit to female partners, so they may need treatment. Most people are asymptomatic, meaning they do not have symptoms, and they may not know they're infected. But when someone is symptomatic, a common symptom is a thin, gray-white discharge that has a fishy odor, which smells stronger after intercourse. The infection is typically not painful, but it can cause some itching, burning, and irritation. The first part of treatment is having good perineal and vaginal hygiene. The perineum is the small area between the vulva, the outside of the vagina, or scrotum, and the anus. Vaginal hygiene includes reducing or stopping douching because the vagina maintains its environment on its own, and water disrupts it. The second part of treatment is antibiotics. The go-to medication is called Flagyl. It can either be a pill that you take once in the morning and once at night for 7 days, or a vaginal cream that you use every night for 7 days. While taking Flagyl, do not drink alcohol because it will cause nausea and vomiting. To prevent a BV infection, you can manage the risk factors. These include diabetes and anything that can change the vaginal environment, such as smoking, the number of sexual partners and new partners, semen, some vaginal birth control options, receptive oral sex, excess antibiotic use, poor vaginal hygiene, douching, and menstruation. If the infection is not treated, it may travel and infect the cervix or bladder and can lead to pelvic pain. It also increases the risk of getting sexually transmitted infections. The more serious complications occur when someone is infected while pregnant. It can lead to early pregnancy loss, breaking your water early, premature delivery, and infection of the uterus. Yes, you can get BV again. Managing the risk factors will help, but it is still possible. So tell your doctor if you have symptoms, then you can get treated again. Before you go, make sure to like, subscribe, and leave a comment. Let me know if you have any questions, have a personal experience in this area that you'd like to share, or have ideas for a future video. Thanks for joining me, and I'll see you next time for another delicious bite of medicine.